Echo TV is a co-production of Minnesota's Emergency, Community, and Health Outreach Collaborative of health, safety, emergency preparedness, ethnic and nonprofit agencies, and TPT's Minnesota channel.
Hello and welcome to ECHO. I'm your host, Lillian McDonald, Executive Director for ECHO, which stands for Emergency and Community Health Outreach. ECHO provides health, safety, emergency, and civic education information in multiple languages. This program, we'll be covering a topic called Healthy Teeth for Children, and we'll be interviewing a couple of guest experts. But first, to get some information on healthy teeth for children, please watch this.
Baby teeth are important. Most children begin life with healthy teeth. Teeth play a critical role in your child's healthy development. There are some important things we can do to keep teeth healthy so that children grow up with healthy adult teeth. When you teach children how to take care of their teeth, they are more likely to continue these habits as adults. Model healthy habits for your children. Brush your teeth every day, eat healthy foods, and limit sugar. Visit your dentist regularly. If you need help finding a dentist or if you don't have insurance, dental care is still available to you. Brushing and flossing teeth is the recommended method of cleaning teeth in the American culture. Some cultures have other ways to clean teeth. Proper brushing is essential for healthy teeth. Your dentist can tell you about how to clean your child's teeth and when to begin using toothpaste with fluoride. Fluoride can help prevent tooth decay. Before baby teeth appear, wipe the baby's gums with a soft cloth or gauze and water. When the first tooth comes in, begin brushing with a soft bristle, child-sized toothbrush. Help your child learn to brush using gentle, massaging action in small circular strokes. Encourage your child to brush for 2 minutes each time and to brush all the surfaces of each tooth. When your child can spit, use a pea-sized amount of toothpaste. Brush and floss your child's teeth until they can do it on their own around the age of 10. To floss properly, wind floss around one finger on each hand. Glide the floss between teeth. Gently rub the sides of the tooth, curving around the tooth at the gum line. It's important to clean teeth thoroughly at least once a day. The most important time to clean teeth is before bedtime. Tooth decay is an infection that happens when bacteria in the mouth convert sugar into acid. Acids damage teeth. To help prevent tooth decay, limit starchy or sugary foods and drinks. Never allow your child to fall asleep with a bottle filled with milk, juice, or sugary liquid. Help your child choose healthy snacks, like fresh fruits, raw vegetables, whole grains, dairy products, meat, and nuts. Your child should visit the dentist once a year or as often as the dentist recommends. A dentist will examine your child's teeth, checking for proper development and dental problems. Your dentist will determine if your child needs further services like cleanings, fluoride, and x-rays. Schedule an appointment with a dentist when the child's teeth first appear or by the child's first birthday. Even if you don't have health insurance, dental care is available. In most areas, there are programs that offer affordable dental care. Remember, healthy baby teeth start with parents role modeling good dental care. Brush your teeth every day, eat healthy foods, and limit sugar. Visit your dentist regularly. If you need to find a dentist or if you don't have insurance, dental care is still available.
Welcome back. You're watching ECHO, Emergency Community Health Outreach. We provide programming in multiple languages, reaching African, Hispanic, and Southeast Asian communities. Our program this time, Healthy Teeth for Children. And we have a couple of guests joining us to talk about that important subject. We have Dr. Amy Ha-Truong from Children's Dental Services and also Elizabeth Branca from Children's Dental Services. Welcome to ECHO.
Hi, how are you?
Good, thanks. Thanks for joining us. This is pretty interesting because the focus is on healthy teeth for just kids. And I'm imagining, of course, getting them off to a good start is critical for healthy teeth for a lifetime. So why is it so critical? Let's start with you, Elizabeth. Why is it so critical for healthy teeth at a young age?
Well, I think healthy habits are good to start, young in life as children. And dental health is really important to the whole body. People don't realize that, but an infection in your mouth can affect your whole body and make someone sick. Bacteria in your mouth can cause dental decay, tooth decay, and gum disease, so that's very important. You know, like exercising or eating well, dental health is part of that and something you can learn to have healthy habits with.
One thought I had, though, is you know, baby teeth they don't show up until about what age?
6 months.
6 months?
6 months.
So is there some oral health care we should be doing with babies before the teeth show up?
Oh, definitely. Like you can take a soft piece of gauze or a towel and wipe their gums off. There's bacteria that is on the gums. It's not the same type of bacteria on the teeth, but it still is bad for the baby, so you can clean it off, and the baby will get used to it, so when they do get teeth, it'll be easier for you to clean their teeth.
Okay. All right, interesting.
Yeah, I think people forget that actually before teeth come in, bacteria will be forming in a child's mouth.
So how often are you doing this? Because I just know little babies and everything, they're rambunctious, and you know, how often? 3 times a day? I mean, that's what I learned, always brush and floss 3 times a day, but the same for infants?
You know, before they go to bed, at least. You know, if they tend to not swallow all their food and it's still around their mouth, then maybe a little bit more often.
Okay.
Yeah, I think after feeding is good, but certainly at night before they go to bed.
Okay. Why isn't it so important to take care of baby teeth? I mean, they do fall out. So, and of course, it's not just the teeth you're focusing on. You've already indicated we're talking about care for gums, to healthy gums for teeth production, if you will. But why are baby teeth so important?
Well, baby teeth, they have them actually until they're 12, so they don't really look like they're babies anymore, right?
True.
But they still can get cavities in them, and it can cause them pain, cause them to miss school, have to go to the emergency room. I mean, you can get a really big infection from one little tooth, so it's very important to...
For children, they can have more so than adults?
Well, you know, if you're not taking care of the kids' teeth, then yes. I mean, they don't know how to take care of their own teeth sometimes. I'd say you need to take care of them by helping them brush and things like that. And if their parents aren't taking care of it for them, then they have a higher risk for infection.
Okay. So the baby teeth are with children at least until about age 12.
Yep.
And the role of the teeth, they're basically setting the foundation for all of the
For the future teeth, it helps actually hold the space, so when the permanent teeth come in, they have room and they're in the right area. So if the teeth are coming out way before the permanent teeth are ready, the permanent teeth start moving, shifting in, and some adult teeth can get blocked out. And then you need major orthodontic, you know, type of surgeries, and it's just not as easy than just brushing your teeth, right?
So the baby teeth do play a key role in setting up, if you will, the template for where the adult teeth are going to reside forever. And if they start kind of growing in differently or not as ideal as you'd like them to be, you need to check on that obviously early, and the earlier the better.
Yep.
Okay.
And I think it helps children's nutrition and, you know, be able to speak properly if they have healthy teeth. If they lose their teeth sooner, they will not have as good nutrition and also not be able to speak as well.
Let's talk about nutrition for a second, because that's, you know, that's an interesting point, because, you know, teeth are developing, and I'm thinking about the temptation for hard candies and just my own bad habits as a child. Let's leave it at that. And then not as much interest in fruits and vegetables, but the teeth are developing just like everything else in your body at a young age.
Yes. Well, healthy nutrition is important for your whole body, but certainly your teeth too. And something that does affect teeth quite a bit is sugar. And sugar will help cause cavities in teeth, any teeth, baby teeth or adult teeth. And what sugar does is the bacteria in your mouth, the germs in your mouth that will eat the sugar when you consume it and actually produce an acid. And the acid will sit on the teeth and start to decay your teeth. So that's partly the reason why sugar is so bad.
How much of a digression is that? I mean, 1 amount of sugar, 10 over time?
Well, that's the tricky part, and that's why almost the most important thing is how many times you eat sugar rather than the amount of sugar in one setting. Because every time you have some sugar, you're going to be bathing your teeth in acid for about 20 minutes.
Okay.
So if you have a candy bar and you eat it, then for 20 minutes your teeth are being bathed in that acid and starting to decay. But if you drink a can of soda, let's say, you might take a sip and wait 5 minutes so that you got the 20 minutes going, and 5 minutes later you're drinking another sip, that's another 20 minutes. So you may be bathing your mouth in acid for an hour. And so frequency is really important.
Well, does it help then, obviously, just brush your teeth after a sugar dose?
Yeah, at least brush it, or you can rinse your mouth with water, helps too.
Okay,
Yeah.
okay. So now, hopefully babies aren't getting much soda pop these days, but they can get sugar from other things, right? Baby foods have some sugars in it? Or
Definitely. Fruit juices, just Coke has so much sugar in it, and I'm sure people don't really always look at the nutrition facts, but it's like 50 grams per can of Coke, and even though you think that some people don't have their babies drink Coke, but you see it pretty often.
Well, let's classify babies then. I'm thinking 1 to 2 is baby's age.
Up to 12, right?
Yeah, okay. So you consider baby teeth clearly up to 12, no matter what.
Yep.
Yeah, okay. Well, children are drinking pop long before 12.
I think a good rule of thumb, which is hard to hear, I think, is that there's about a teaspoon of sugar per ounce in a can of soda.
Okay.
And
That's
seems
a lot.
If you imagine putting 12 teaspoons of sugar in
Per
a can.
ounce?
Wow.
1
teaspoon per ounce.
Oh, that's a ton.
That's pretty much of a rule of thumb. It's a little bit less or more depending on which sodas. Some are sweeter than others.
And fruit juices are naturally sweet, and some are also added with sweeteners.
Yeah, fruit juice is pretty tricky because although it's naturally sweet, it is a sugar. And so it's not very good for your teeth and not necessarily that great for your body. I mean, we have a dentist who says, eat the fruit, drink the water. Which I think is a good...
It is a good idea. So we need to start young so that we develop good habits. We also start young so that we develop proper nutrition, which helps provide for a foundation of teeth in the mouth, which eventually sets a template for healthy adult teeth down the road. How to care specifically for babies' mouths? How do we care specifically for babies?
Well, with babies' mouths, like wiping the gums is a good idea, or cleaning the teeth, brushing them, flossing them. But also, we're talking about the food they eat, like crackers, ice cream, things like those. If you think about Cheez-Its and how they stick to our mouth, and we can brush them, but if little babies are eating them all through the day, like frequency is the same thing with crackers. They're stuck on the tooth. They're still feeding the bacteria in the mouth. And ice cream has lots of sugar in it too. So it's good to take care of what you're going to feed your baby as well.
So we're avoiding sugar as best we can, knowing that children will get sugar from time to time and just naturally in our foods. We're keeping their mouths clean as possible, at least before bedtime. 3 times a day is ideal. You make a good point, though, about food in babies' mouths all the time. We're always kind of giving children something to munch on, Cheerios or cereals or crackers or something, just to kind of keep them busy. And that also shapes proper diet that can live with them and their teeth every day. And you said that quantity is important. Now, you're talking about 1 teaspoon per ounce in a can of soda pop, regardless of brand. But it's hard to keep it away completely from them. How would you address it? Can you have 1 can of pop a day, once a week, or what would you recommend?
I would say really limit it to like 1 treat per day. It's very difficult, and as a parent I know it's very hard, and kids want to have sugar, but if you limit it, and I think again the frequency, it's not that you're going to have snacks between meals all the time, maybe limit to 1 treat per day and not having, like you said, crackers throughout the day and cookies throughout the day, or juice in a sippy cup throughout the day.
When's the first time we should take our children to the dentist?
Oh, I'd say when their first tooth comes out.
Okay, so it could be as soon as 6 months.
Yeah.
Okay, and what would we expect at the age of 6 months from a dental visit?
A good exam and fluoride sometimes if the patient needs it, and they'll maybe get a cleaning if they need it, x-rays. So just a good evaluation, and then from there we can see if they need to get fillings or anything else like that.
Okay. What about toothpaste? Are there specific toothpaste for babies, or does that really matter? Just want to get a good fluoride-based toothpaste.
There's a good fluoride toothpaste, but sometimes for kids' toothpaste, you don't want them, if they're very young, to give them a lot of fluoride in their toothpaste, so they have kids' toothpaste. because if they ingest too much, it's not too good for them to eat too much toothpaste. And the kids' toothpaste, it's a little bit more fun. There's more
bubblegum flavored.
Yeah. And then
exactly.
they'll want to do it at the end of the day, in the beginning of the day, maybe all day, hopefully.
Yeah.
Yeah, so I think if a child can't spit out, you want to use a non-fluoridated toothpaste.
Okay. What's interesting about this is, there's always some kids that just absolutely hate to brush their teeth, and flossing on top of that. And I don't know if it's just a part of growing up or what it is, but there's only so much you can do short of standing over them every single time. But really, you might have to do that just to get them going.
I would say if your child can't write their name yet, then you would need to help them brush their teeth. If they can't, until they can tie a bow in their shoe, then you can help them floss.
Okay.
So it's just hand-eye coordination, if that kind of correlates with each other.
Okay.
And make it fun. I mean, a child can, there's lots of toothbrushes out there. They could choose their toothbrush with Spider-Man on, or a cartoon character. A lot of toothpaste, like you said, are bubblegum flavored or something. A lot of toothpastes are actually very strong.
Yeah.
Mint is actually a very strong flavor for kids.
That's
so you want to get
kids too, I would
think.
Yeah.
Get something that's fun. You can give them incentives, put stickers on charts or something. And I think what your habits are, your role modeling is very important. Parents role modeling brushing and flossing, then the children tend to role model that too, and brush and floss.
Yeah.
Positive reinforcement's really good. And actually, in our family, all our cousins get together, and we have little ones. We all brush their teeth together. And at first, they didn't want to brush their teeth, but once they see everyone's doing it, then they love to do it.
I'll have to admit, that's the way it was in our family too. We had some cousins, and I'd have sleepovers, and that's just part of the deal. Is all the kids get together, everybody's up there brushing your teeth, 10 here, 10 times here, 10 up here, 10 up here, and the next thing you know, you've got some clean teeth. But you are developing habits. To this day, I still think of things like that. What about medical emergencies? Because they come up with children all the time. I got my tooth knocked out from baseball, or I tripped over my handlebars on my bike. Those are the obvious ones, but what to do? Because that comes up too with children.
I think with dental emergencies, if a tooth is actually knocked out, there is a possibility to re-implant the tooth. So you want to save that tooth either by putting it back into the socket or putting it in some milk and
right away,
and seeing a dentist right away. Other emergencies, if your tooth is broken or chipped or whatever, or just even traumatized, it's good to see your dentist right away.
So if we have a trauma situation and the tooth is knocked out, put it in a glass of milk. And what does the milk do? Might sound like an obvious question. It has calcium in it, but...
Oh, it helps with the cells. If you put it in water, it kills all the cells and they die. And when you implant the tooth, there's less of a chance of it to, reattach and stay there for the rest of your life. It's an adult tooth. Milk, it helps and it protects it. And you can, most likely, if you clean it off with the dentist, they can put it in and help splint it on. We put a little thing on there, bond it, and hopefully it'll stay for a really long time.
Okay, well, that's a good luck. And finding a dentist can be a challenge. The best way to find a dentist in an emergency under pressure, if you don't have one already, what's the best way?
Find the nearest one, or you can sometimes just go to the emergency room, but usually if there's a dentist open, you should just go to anyone close to.
And we'll have some resources too on echominnesota.org, our website, for folks that may be looking around for a dentist. What about how much milk to drink? This goes back and forth, it seems to, on different science studies about how much milk should children have to help enhance their teeth. Is it all about milk? Obviously, milk is one component of nutrition. What is your advice on milk in terms of how much to have for healthy teeth?
I think milk is in the category of dairy, so like cheese, yogurt, having a good balance, 2 to 3 servings a day is good for children. It doesn't just have to be milk, but as long as you're not drinking the milk right before you're going to bed, the children, if they have bottles in their mouth of milk, or, you think juice is good, but if it's bathing your teeth all night, that's 8-10 hours of juice in your mouth, the bacteria is really happy. And then you gotta have a much higher increased chance of getting decay.
What about gum? Good or bad?
Good.
Really?
Sugar-free gum is good for your teeth.
Okay.
Not sugared gum, but sugar-free gum is good for your teeth.
What makes it good?
What it does is it increases saliva in your mouth and it helps clean out your mouth. So actually, it's not a bad thing to do after a meal, especially if you're not near a toothbrush.
Well, speaking of toothbrush, let's talk about the proper way to brush, because I know it seems simple, but it's really not as easy as what you think. You want to do a little demonstration with the proper way to brush and floss.
This is our large brush and our large teeth. Brushing, essentially you want to brush every tooth in your mouth and every surface, which sometimes, people don't think about, or kids especially forget if they're standing in front of the mirror, just brushing their front teeth. And you also would like to brush in small circles. So, I'm gonna lift.
So not up and down, but more of a circular motion.
Right, it's actually better to brush into a circular motion.
Like a nice wand. I like to tell the kids in the practice, pretend you're using a magical wand to clean off all the plaque and all the food.
Okay. And getting all the surfaces where you're getting sort of the cheek side, and then certainly the tongue side of your, you can come in from this angle, the tongue side.
So we want to be sure and get all the way around on the bottom and on the back.
Right,
and in the
on
front.
the chewing surfaces.
Do you have like a time you would recommend? You need to take 5 minutes for brushing, or 10 minutes, or just until the job is until you got all the bases covered?
They say 2 minutes is good to brush your teeth. And some kids, you could play a little song for 2 minutes, and that helps them, brush that whole time. Or some toothbrushes have timers where you brush for 2 minutes. But you do want to make sure you get all surfaces.
Okay.
The thing, if you look at a tooth, it's really a cube. So you might brush, the top and you brush the side, and this side too. But unless you're flossing, you're not getting in between the teeth, which is where bacteria will sit, and that will cause tooth decay or gum disease.
Which is why the flossing is so important.
Right.
How about a demonstration on the flossing?
Sure. If you have regular floss, most kids can't really probably do this on their own till like 10 or 12. And they could use sometimes little floss picks where the floss is in plastic, and that makes it easier for kids. And otherwise, it's good for an adult to floss a child's tooth until they're about 10 or 12 and able to do it themselves. But when you floss, it's good to put it around your middle fingers like this. And there's many ways, whatever works, but this is the standard way. And then you can use these 2 fingers to move the floss around.
Okay.
And then you want to carefully slide it, sort of like a seesaw, down into the gum line, and go under the gum line and wrap your floss like a C around the tooth and go up and down. So your gum is sort of like a turtleneck around your tooth where you can get right in there.
That's a good analogy, sure.
And
slide praise is important for this work, telling your children, good job, way to go, and reinforcement. Good. So brushing and flossing, flossing every day is very critical. How about dental visits? How often, you mentioned get them in there at as early as 6 months of age. How often should they see the dentist?
I'd say about every 6 months is usually the typical exam or cleaning. But it really depends. If you're really, really good, sometimes maybe a year. But it really depends if you need to get more fillings done or more frequent cleanings, sometimes even 3 months, but usually 6 months.
Now, I know insurance sometimes will only cover 1 trip to the dentist a year, and it all varies. You have to check your insurance, and there are some that may not have insurance. Can we still get to the dentist?
Definitely. Like at Children's Dental Services, you can go to them and they have sliding service, sliding fee, and you can always get, try to get government insurance or other types of insurances if you don't have any right now.
So now Children's Dental Services, of course, here in the Twin Cities area of Minnesota, but other states who may be seeing this broadcast on our website, for instance, they can check locally too with health departments. Is that a good spot to check?
Yep, or any community dental clinics. There's various locations all across the country. So.
Okay, wonderful. And there's medical assistance programs, assured access programs, Minnesota Care here in the state of Minnesota. So check it out for dental assistance.
And there are many places like Children's Dental Services, which I think is a medical assistance outstation that will help you get insurance, help you see if you're eligible for public insurance, and help you sign up for it too.
Okay.
And there are many places, I think, that'll be on the Echo TV links, right, to talk about community health and different places that have reduced rates and sliding scale dental services for people.
Let's go back to just a couple of other quick details here on the brushing and the flossing. With children, especially with young ages, And you mentioned this earlier about the fluoride, to be really careful that they spit and they empty and rinse their mouths, right? Not to swallow toothpaste.
Yeah, it's important not to swallow toothpaste because there's a lot of different things in there to help clean your teeth, but it isn't meant to clean your stomach or, everything else in your body. So it's good to, be able to help them, and you can also wipe it out if they're not really getting the foam out.
Okay. And briefly, I know it's also important that they see a dentist at the first year of age, or when the first tooth shows up, essentially, which could come anywhere after about 6 months of age. And rather than an emergency room on an emergency tooth, call the dentist first.
Definitely.
And call your local dentist if you have one, and if you don't, try to get some references.
Right.
Okay.
Yeah.
All right. Well, I want to thank you both for joining us on Echo. We've talked about a lot of things, and there's always much more to cover, but we basically want to summarize some of the key messages of this particular program. First of all, it is so important to brush your teeth every day. Second, eat healthy foods and limit the amount of sugar you ingest. Number 3, visit your dentist regularly. And number 4, if you have insurance or you don't have insurance or you need help finding a dentist, dental care is available. Check locally with organizations including health departments or dentist's office, because there are resources available to get your children some proper dental care at a very early age. And the earlier, the better. Thanks again. I want to thank Dr. Amy Ha-Truong from the Children's Dental Services and Elizabeth Branca, also from Children's Dental Services, for joining us on Echo. We've talked about a lot of things, but if you'd like more information on this topic and others, please visit our website, echominnesota.org. For now, I'm your host, Lillian McDonald. Until next time, have a great day.
Echo TV is a co-production of Minnesota's Emergency, Community, and Health Outreach Collaborative of health, safety, emergency preparedness, ethnic and nonprofit agencies, and TPT's Minnesota channel.